first question I asked Dr. Jonathan Lupton of Franciscan St. Francis Health is one that many women likely want answered. Why do so many of us over the age of 40 have problems with urinary incontinence?
It can be a lifetime of lifting and coughing and straining. It can be influenced by the type of tissue that a woman inherits from her parents. There can be genetic predispositions. Childbearing and childbirth is also another risk factor for pelvic disorders.
This is especially true for women who delivered their children vaginally as opposed to having C-sections.
How do you know you have a serious enough problem that you need to see a doctor?
For something like urinary incontinence, for some patients it's very mild and it happens only occasionally, in which case they may not feel it needs to be addressed. Others have it quite significantly and it happens often, and they do feel like that they need that addressed in the office.
Doctors at Franciscan St. Francis Health want you to know that you don't have to suffer in silence. There are treatment plans and therapy options available that can help you and give you a new lease on life.
So you bring them in, you say, first of all, let's figure out what's provoking your activity. Secondly, let's teach you some exercises to strengthen your pelvic floor. We hear about the core, and so important, right? And what people don't realize is the pelvic floor is part of your core.
These actors are showing what happens when a patient comes in for treatment. In addition to urinary incontinence, doctors and therapists at Franciscan St. Francis Health can help patients with bowel incontinence, which usually involves recommending changes in diet. Doctors and therapists can also help with pelvic pain. In as little as 6 weeks, patients can begin to notice changes in their quality of life.
I had a gal yesterday, and we're just 1 month into treatment, and I had a student observing, and she looked at the student. She said, "I need you to know that I have my life back. I go out with my grandkids now. I'm not scared to leave the house. I don't have to pack a change of clothes. I really feel like I have my life back." And I mean, that's why we do this.
The most important thing to know is that if you're experiencing incontinence or any kind of pelvic pain or discomfort, you don't have to just live with it.
You've strained really hard to go to the bathroom for a long time, and all of a sudden these muscles, just like in a neck or back, seize up, and you've got real pain. And so I would tell them, keep telling someone until someone listens.
Grace Trahan, Boomer TV.